All right, so I really want you guys to practice the marker thing, not because you're going to draw on your patients, you sure can if you want to, but because in order to draw on your patient, you're going to have to palpate everything, okay? And you definitely want to be able to know, here's my shoulder blade, so we can needle, and I have a safe place to needle, because our shoulder blade is going to be our bony backdrop. It's big, but when you're at the outer limits of it, you want to be sure. And there's other things we can do, right? We can angle the needle like super towards the bony backdrop, you know what I mean? So instead of being here and it's ambiguous, we can come up a little bit and we can go, we got this whole thing, right? So let's go ahead and start on the shoulder blade. However you guys want to do it is cool with me. What do they call that? Like lat spread? Wings? These wings, baby. Look at these wings. You got some wings. These are some buffalo wings. These ain't no chicken wings. Don't be offended, it's a compliment. Good. It's like, man, somebody said I had buffalo wings today.
He's going to be talking about for the next 2 weeks about that.
Excellent.
I'm going to have to do it.
Okay, in here, there's enough muscle bulk that sometimes we can't always definitively feel the edge of the shoulder blade, and that's okay because what we're going to do in here anyways is a pinch technique. Okay, I'm not going to be like, oh yeah, let's hope we hit shoulder blade here, right? Now we're obviously like the lungs end here, so anything out here is like pretty safe. But we still want to know where we're needling. We don't want to hit brachial plexus, brachial artery by accident with a long needle. So we're going to come in and pinch the muscles we want here. Teres major, teres minor, lats, right? We can pinch and needle, okay? And then on the shoulder blade itself, we can also hit teres major, teres minor, infraspinatus. Let's draw the spine of the scapula. Where is our spine of the scapula? So we're going to find the spine of the scapula. We're going to come all the way until it disappears into nothingness. And then I'm going to try to bracket like either side of it. All right. You guys don't have to make this like super pretty. I just want you to palpate it. Like, we'll know where this thing is, right? My first 100 drawings sucked. Art is like my weakest point. So it's okay if they're not like super pretty. And then we can feel a joint line here. So that's the end of the acromion. There's our guy right there.
That looks beautiful.
Thank you. The other thing that's going to happen is once we get to the spine of the scapula, we get enough like levator scap and upper traps. It's really hard to feel this border here. Okay, it's really hard to feel that guy. So we are going to play Imagination Station a little bit. Here you go. Okay. Now, because this is like a drawing on top of a 3D thing with muscle mass and stuff like that, this is loose guidelines, but you still want to be, don't take it for granted, right? You still want to be feeling around that, and you want to make sure when we're sticking a needle in, we got a bony backdrop. Okay, so. Where are we here? All right, so you guys know we got supraspinatus in here in the supraspinous fossa. Infraspinatus makes up most of our shoulder blade with the exception of minor and major. So loosely, if you draw in this infraspinous fossa halfway and then another half, you got minor and major, right? And you guys remember which one's which? Minor is an external rotator. So minor is going to come to the outer part of the shoulder, along with infraspinatus. Major is the one that's going to tuck underneath. It's an internal rotator. So, but all of it we can hit in the shoulder blade. So we can needle trigger points in infraspinatus. We can look in this zone and we can hit trigger points in teres minor, teres major. We're just looking for trigger points in here. You could also come in here and you have your fingers as a backdrop for all of this. Boom, 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 right? Just angle it towards your fingers, okay? All of that's fair game, okay? Along with lats, right? Thank God for big lats. They're easy to find. And we know lats kind of hugs. A lot of times it kind of hugs the bottom of the shoulder blade. And then it comes down here. And this is all like lats on top of paraspinals and stuff like that. So thoracolumbar fascia and stuff like that. Sorry, this pin's not showing. Super amazing. If you guys need me to highlight anything or make anything darker, we can. So infraspinatus in this zone, right? Palpate for trigger points. Teres minor, teres major. We can catch it on the scap or you can catch it off the scap, okay? I would love for you to do both. Even infraspinatus. Let's get them on the scap. Let's get them off the scap, okay? And then lats down here, anywhere, as long as you're using this pinch technique. And I would say, which way are we going to angle? Why not angle a little bit lateral, right? That's just no brainer. So there's our lats, right? Supraspinatus, how are we going to deal with that guy?
Into the
So it's
fossa.
the spine of the scap.
Kind of like we did here. Curl around it and angle this way. We're going to find spine of the scap. We're going to curl down onto that and we're going to needle straight down, okay? If we needle directly from superior to inferior and your fingers are wrapped around the spine of the scapula, it's a no-brainer, right? Because we've got spine of the scapula and supraspinatus fossa. So if my fingers are wrapped around the spine of the scapula here, as long as I needle anywhere like that way, we're safe. You can probably hit, 30 degrees, 45 degrees, 60 degrees, 90 degrees, right? Just don't be straight. Just don't go straight that way. You guys can see he's got so much upper trap. Anything above this is just upper traps, right? So in his case, we could do that, but man, we don't want to. Let's wrap around that spine of the scapula and let's go straight inferior like that, okay? This is an opportunity to get a little bit more upper traps practice. If your patient doesn't mind, and if you feel like you need the practice, want the practice, you can go ahead and come in here and get upper traps another time. Up to you. We're not gonna do these guys yet. Rhomboids, mid traps, lower traps, thoracic paraspinals. Let's save those for the next round of needling, okay? But I think these are fair game. Any questions on these? Your lab manual is immaculate. I do say so myself. But it can also take a little bit longer to read through and get through. So get me or TJ. I don't think you guys have done a lot of scapular needling. Iden has, so get me or TJ or Iden. If you need a hands-on, just put your hand up and wait a sec. We'll be there real quick. What's up?
What's the best position to have his arm in? Is it like that hanging off the table? Or is it like down to the side? Does it matter?
In shoulder pain, whatever the patient can tolerate.
Okay.
Let's say whatever the patient can tolerate. If they're here, you don't really get axillary access.
Okay.
So if you want to
Yeah.
get to the VIP,
Mm-hmm.
you gotta get. you got to have the arm out a little bit.
Mhm.
And if you put the patient here and they're having pain or something, you can get like a towel roll or a pillow. Sometimes that feels better. You know what I mean? So just whatever the patient needs, but let's have the arm out a little bit. You good like that? You comfy like that?
Yeah, that's comfortable.
Okay, cool. So, would you guys like me to go ahead and needle those? Would you guys like me to demonstrate that? Okay. Since we're needling around the shoulder blade, we could probably get by with one of the smaller needles. Check out my patient. He's huge. I'm gonna use a bigger one, right? Okay. Big guy.